Hi, my name is Valerie Ross. I'm a marriage and family therapist by training, and I'm also director of the behavioral science curriculum for a family medicine residency program. I've been working and practicing as a therapist in medical settings for at least 20 years, and in the past 5 or 6 years, we've been moving much more towards an integrated model. In my practice, I see patients who present with common problems such as depression, anxiety, panic, substance abuse, and often grief and loss. Many of these patients also have chronic illnesses, and in the past 4 to 5 years, our setting has been working on creating integrated models for care. As care moves towards more integration, I'm finding at least 3 major aspects of my work really satisfying. The first is my experience reflects studies that show integrated care is better care for commonly occurring problems such as depression. Second, it's actually really stimulating to be able to use my skills beyond patient care and contribute to team building and staff and provider education. And third, as part of a team, I feel really connected rather than isolated in my practice. Let me share with you a few examples that are pretty simple and common, but that can illustrate these 3 points. We know the majority of depression is treated in primary care and not in therapist offices, but medication and behavioral interventions together have been shown to be the most effective for treating depression. However, many patients are initially skeptical of treatment, either therapy or medication, due to the stigma associated with mental health issues or fears about medications. In an integrated setting, patients have often told me they're willing to try to see a therapist, that's me, because they trust their physician and feel decreased stigma in the medical setting. So I'm seeing people who I wouldn't see otherwise. If patients may benefit from medication, I can take the time to understand their beliefs and help them find ways to discuss their fears or concerns with their physicians. They know we work as a team, and these conversations can and have increased the use of life-saving medications by patients. And if the patients need their medication to be adjusted, it's easy to access their prescriber. Often during a session, I've taken a break and walked down the hall to talk with the provider. Patients' medications can be adjusted there on the spot, or concerns can be addressed by the provider at least the same day. And this promotes good care, patient satisfaction, and trust in us as a team. I utilize other team members such as nutritionists, care managers, and health navigators to promote support for my patients regularly. Many of the patients I see, as I've said, have co-occurring health issues. When we work as a team, we can help patients problem solve and address barriers to caring for themselves. For example, we know there's a link between eating disorders and anxiety, and I've worked with a number of young patients who are beginning to show signs of a developing eating disorder. They benefited from early education about intuitive eating from our nutritionists, while the patient and I worked together on skills for managing their anxiety. Another way I've found that can be effective is in helping providers understand the psychological and social barriers their patients face taking care of themselves when they have chronic illnesses. Studies have shown that better health outcomes are linked to provider empathy, and understanding patient stresses that get in the way of taking care of chronic illnesses can improve patient-provider relationships, and addressing these stresses leads to better health outcomes. A diagnosis of a chronic or life-threatening illness can tear a family apart. And as a family therapist, some of the most satisfying times for me are when I can help families strengthen their relationships while adjusting to chronic illnesses. Usually this work is very collaborative between the patient, their primary care provider, and myself. And we work together closely, celebrating successes, helping patients and families navigate the medical culture, and supporting each other during difficult moments when patients are in crisis or facing death.